ladies and gentlemen, and welcome to the session. If you are ready for a great evening tonight, can you please type a one? Type a one, type a one. Let's do this, ladies and gentlemen. You are with your boy Marvin tonight, the best place to be. I'm going to go through every single thing you guys need to smash this exam. Others have done it. You can do it too. Remember, every single year in June, the pass rate has been above 70%. So there's no reason why you wouldn't pass. 70% of trainees minimum have passed exam in June, and you will be one of them. There wouldn't be any replay session tonight, so anyone who doesn't attend is not going to have access to what you guys are about to get. This is special. I have the golden nuggets for you. I have all the tricks, the system, the strategy, the principles, everything to get you through this exam. It is not as bad as you think, and you will pass. So great to have all of you on. If you are ready for a great session tonight, can you please type a yes? Type a yes. Let me give a special shout out to all of you. I've turned up tonight, 122 of you, which is very great. Aksa, how are you doing in the house? Roshni, great to have you. Ace, great to have you. Madison is in the house tonight. Ifas, Hussein, Sarah. Wow, there's loads of you. Please just send the link out to your colleagues and tell them we have started. If they are serious of passing the exam, they need to turn up tonight. They need to turn up. So I said, Marvin, how accurate are these? How accurate are your predictions? Guys, it's called predictions, right? The only person that could give you the most accurate what exactly is going to be in the exam is the GPhC. All we can do is we give you predictions. I give predictions every single year, and my predictions normally come up. Now, am I saying, hey, guys, this is exactly what's going to come up? These are predictions. The word prediction means we are predicting this is going to come up. So all this means is you need to make sure that whatever you do, you learn these areas and you learn them well before the exam. And I can bet you 100% based on the past questions that have come up for the past years in the GPhC exam, we've always had loads of questions from these areas. That's why we call them the common assessment areas. Anyone who's looking for, oh, I want to know every single question that's going to come up in the exam, nobody's going to tell you that. Only the GPhC. All you can do is go through that GPhC framework, look at what the GPhC is saying on the website, look at areas that students struggled in the past, listen to other trainees that have done this exam, try to see the sort of questions that are being asked, practice the mock papers. That will give you an idea of those most common areas that you need to know. So today is all about predicting. And every single year, I've been doing this for 10 years, guys. For the past years, I've been predicting, and majority of the time, every time trainees have come out of the exam, they've said the same thing. Marvin, these things have come up. And the reason why these things come up, why they're so important, is because these are the areas that you practice in your pharmacy majority of the time. In the June exam, we've always had 70% pass rate and above. Even times when the exam has been so difficult, where every single trainee has complained, oh my God, it's been the most difficult exam ever. The questions were so wordy, Marvin. Oh my God, I'm going to fail. Even those worst times, we've still had about 80% pass rate. There was one year where we had 95% pass rate in June. So guys, here is the truth. The only one that is going to stop you from passing this exam is yourself. Stop playing small and stop disbelieving and stop acting as if you've not come from university, as if you don't have the capability, as if you've not gone through pharmacy for 4 years, you have a master's degree, you are smart, you are intelligent. If your tutors even put you forward for this exam, it means you have the capability. Stop playing yourself down. Build some confidence. Build confidence. Believe in yourself. Stand up tall. Others have done it. You can do it too. And there's no other way to think about this apart from I will pass. Right? Be positive. So it's about positivity. And that's the only way you walk into the GPhC exam. You walk tall, you believe in yourself, you go out there and you make it work. Right? So today is all about believing in yourself. The only thing that's going to stop you are your doubts. Asking yourself, oh my God, I'm not good enough. Oh my God, I've not covered the highway chapters yet. Oh my God, I know Marvin, 70% of students pass at least, but I will be amongst the 30%. Stop playing small. Stop playing yourself down. You've gone through university. You've got a master's degree. Believe in yourself. Okay, you are smart. You have what it takes to succeed. Get up, work hard, go out there and totally ace this exam. All right, let's do this. So, ladies and gents, are we ready for a great evening tonight? I am gassed, I am excited, and I'm going to help you pass like I've done to so many other trainees. And I am really, really happy today because then we're going to go through those areas and I'm going to show you all those high rating chapters as well. Today, we're going to do infections, but I will still do some live sessions, and those live sessions will be on the different areas as well. We're going to look at cardiovascular system. We're going to look at the CNS. We're going to look at the endocrine system. Guys, this exam is doable. It is passable, and you will pass. All right. We have the lovely Lisa in the house with me tonight from Previous Shortcuts. Lisa sat this exam. I think Lisa didn't pass the first time. She passed the second time. And Lisa's gone through the challenges as well. And here's what I have to say to all of you. Again, I'm telling you, the only person that's going to stop you from passing are your self-doubts. Doubting yourself, not believing in yourself, thinking you're not good enough. Oh my God, Marvin, maybe I don't know, I'm scared. Why are you scared? The GPhC exam is not there to trap you. If that was the case, you're not going to be getting more than 70% every June exam. It is impossible. The GPhC is not there to trap you, to give you difficult questions. The GPhC wants to just make sure that you have that basic knowledge, which you will have because you've done your foundation here. As long as you've been working the pharmacy, the common things are common in your exam, ladies and gents. If you're on a good training program, you've gone through some questions, some mock papers. Guess how many questions you can get wrong in this exam and still pass? How many questions, ladies and gents, can you get wrong in calculations and still pass? Type in the comments, please. How many questions can you get wrong and still pass this exam? Type in the chat. How many questions can you get wrong? So every single exam, it changes based on the exam, right? But generally, we're looking about 12 questions. Guys, you can get up to 12 questions. We've had exams where it's been up to 14 questions wrong and still pass. That means in calculations, you don't need to know every single thing to pass. You don't need to be the best to pass calculations. You don't need to be a genius to pass clinical. All you need is just enough marks to get you through. You can fill 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12 questions in calculations and still pass the exam. How many questions, ladies and gents, can you get wrong in clinical and still pass? Type in the comments. Let's see. DM, you had 12 for Cox, Sarah 12, around 15. Yes, Omar, Mesnick says 15, Jay says 12, Joshua says 13, 14. Absolutely correct. It changes each exam. So Sarah, for clinical, what are we looking at? Sarah says 35. 35. We've got AS 20. AS, you'll be pleased to know that you could get more than 20 wrong and still pass. We've got 35. What else? What else? Let's see. Jerry, man like Jerry in the house is 35. So guys, with clinical, you're looking on average about 35, 36. This means, ladies and gents, you can fill 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, 31, 32, 33, 34, 35, 36. Guys, I am out of breath. That's how many questions you can get wrong and still pass the exam. So what are you scared about? Oh, Marvin, but you know, I'm the one that's going to fail 100 questions. If you get 100 questions wrong in the exam, I am sorry, you haven't prepared for it. Now, this is your fault. This is your fault. If you get 100, the GPhC is not there to trap you. If they were there to trap you, they're not going to let you fail this many questions and still pass. So the ball is in your court. It is doable. It is passable. So today we're about building our confidence, and we're saying to ourselves, we don't need to be experts to pass the GPhC exam. We don't need to know every single thing to pass the GPhC exam. And if you're doing that exam in June, which I know most of you are doing, looking, numbers lie, but men lie, women lie, numbers don't lie. And if you look at the numbers, it has always been above 70% pass rate. I'm going as far back as 2011. So are we ready for a great evening tonight? If you want, type of me, type of me, type of me. And there's nothing to be scared about, because when I come on board, I give you confidence and I show you what to focus on, and you will walk out this place. And if you do what I'm about to show you right now, guys, you're increasing those chances even further for yourself. Great stuff. So here's our agenda for today. Number one, we're going to look at GPhC exam predictions for infections. Remember, predictions. No one can give you the exact questions unless it is the GPhC. Only the GPhC knows. I don't know. No mock paper knows. No training provider, Pro Farmers, Buttercup. No one knows exactly what questions are coming up. If they do, then that's a serious issue. But what we can give you are predictions, and every time I've given these predictions, they have come up and students have done extremely well. And I'm confident here to tell you today that if you follow what I'm about to show you, and if you stay positive, you will smash this exam too. Okay? GPhC exam predictions, we're going to look at 7 most common assessment areas. Guys, remember the word most common. I'm not saying the only 7 areas are going to assess you on, but these are the most common ones. What does this mean for you? This means, the predictions mean, whatever you do, make sure you at least know these things I'm about to show you. That's what this means. It means make sure that you know these things, because most of the questions will come from here. And if there's anything that you don't know, please learn it before the exam. Okay, great. Let's jump in here. We've got Mohammed Amir. How did you get such an accurate prediction, and what do you think will show up in calculations this year? We will go through. Again, you will get predictions. Guys, this is what I'm going to say to you. This exam, the GPhC gives you clues for the exam. All right, when we talk about predictions are not that difficult. Prediction, if you look at the pattern, if you look at what's been tested, if you speak to other trainees, if you look at what the GPhC posts on the side, if you look at the feedback from the GPhC exam, which they always post on the website, they give you clues. There are clues. And you can literally predict patterns, and you can see the areas that are the most important. That's why the GPhC has even given you the framework. What is the framework? They're trying to guide you what to focus on. They've told you this already. They've told you that listen, up to about 70%, 65% of questions will come from your high rating areas. They will come from your nice chapters. Your nice chapters are your nervous system, infections, cardiovascular, endocrine system. The GPhC has told you this. They've shown you the high rating areas. They've told you that of all your GPhC framework, your high risk drugs, your high rating areas, there are specific areas that they would definitely ask you questions on. So doing a prediction is nothing strange, because the GPhC actually helps you to guide you. So guys, 7 most common assessment areas. Then you have 27 common infections. 27 of them. Oh, Marvin, but oh my God, 27 is so much. No, it's not, because by now most of you know most of these infections. Chicken pox, you all know about chicken pox. Impetigo, you must know about impetigo. So these are not the common things that are common in your exam, guys. Right? They're going to test you on things that you see every day in the pharmacy. I did a session last time. I'm going to help you guys. You need to learn how the GPhC actually puts questions together. Right? One of the ways they put questions together is they get many different pharmacies from many sectors. Some are from hospital, from GP surgery, prescribers. It's a whole mix. And these pharmacies will then submit questions to the GPhC. The GPhC is then going to go through. There's going to be a multi-review process, and then they're going to choose what questions they're going to put in your exam. Now, these pharmacies that submit these questions have a criteria which they have to follow when setting the questions. And these are normally meant to be questions and scenarios that they face in practice. So many of the things you're going to get in terms of the questions are going to be based on questions that you face every day in your pharmacy, right? It's going to be things, because the whole idea, the GPhC wants to make sure that from day one, when you register as a pharmacist, you'll be able to deal with all these challenges that you're going to face in the pharmacy as the responsible pharmacist. All right? They don't need you to be an expert. They don't need you to memorize the whole BNF. They don't need you to know every single thing, to master all calculations. All they need from you is to be able to do this safely and be able to at least get a pass back in your GPhC exam, which is totally doable and within your reach, all of you. So 27 common infections we're going to go through. We're going to look at most common drug side effects. We're going to look at common causative organisms. We're going to look at 14 common rashes and red flags. I'm not going to do a free raffle, so let's ignore that part. But hey, guys, these are the most common areas that get tested in the GPhC exam when it comes to infection. So a bold statement I can make to you right now is, if you look at the questions that come up in infections chapter, they would generally ask you questions on common types of infections. So it could either be something on impetigo, or it could be something on that needs some condition. It could be impetigo. It could be some of your minor ailments that you do every day. Again, it could be a chicken pox, it could be otitis media, it could be mastitis, it could be some fungal infection, it could be recognizing a rash, but they will ask you these questions and they do these all the time. All the time. So let's go in. So number one for you guys, and I want you guys to interact with me, give me your answers, tell me what you think. Common areas. So most of you have been studying. What have you been focusing on? What are the common assessment areas? What are they going to test you on when it comes to infections? What do you guys think? Type in the chat below. What areas? So if you're reading the infections chapter, are you just trying to learn every single thing in infections? Or do you have a clue that in infections, there are certain infections that the GPhC likes to test me on? Now, here's a clue for you. Common things are common in the exam, right? Those conditions that you tend to see in the pharmacy, that you dispense medication on every single day, tend to be the things that are going to test you on. So great stuff. You are answering this question. So what you're effectively doing, ladies and gents, is you are doing predictions yourself. You are doing predictions, and your predictions are correct. This is why I know all of you are going to pass. NASD, fantastic. Community-acquired pneumonia, hospital-acquired pneumonia. In terms of predictions, it's an area you definitely need to learn. They tend to ask you questions on pneumonia, right? They love it. Sepsis, absolutely. Sepsis has come up a few times in different exams. Sepsis comes up. It's one of those common areas to test you on. C. difficile comes up a lot as well. Another condition. Acne, yes. UTI, 100%. I will give UTI right up there. It comes up so much that you have to learn UTI. You absolutely need to learn. BV thrush, yes. Meningitis, absolutely. H. pylori, yes. So all of these are predictions, and you are correct. So all I'm doing for you today is I'm putting everything together in a list, making it easy for you. How many of you like me to give you everything easy in a list, in a table, to make your life easy? Please type a 1, type a 1, type a 1. Remember, pharmacy first. Know your pharmacy first conditions, right? They tend to come up in your exam. They were coming up even before the service started, right? You were tested on these conditions already. So learn them. All right. So let's get in. So here are the 7 common areas. When I talk about areas, these are the areas they tend to ask questions on when it comes to the infections chapter. Number 1, take a screenshot because there's going to be no replay after this. There's 334 of us on here. That's amazing. 334 students are serious about passing. So here we go. Common infections. There are 27 of them, and I'm going to show you that in a minute. And all you have to do is learn these. They're very important. Someone says, "Oh, Marvin, I thought pharmacy first not tested in exam." Guys, here is the thing. It is important. Now, they may not test you on pharmacy first as a service, because there are probably some areas in the United Kingdom that don't have the same service, but they will test you on the conditions. So when I talk about pharmacy first, I'm not necessarily referring to the service itself. I'm talking about the conditions. These conditions have been tested for a long time in the GPhC exam, even before pharmacy first started. So hey, don't get it confused, don't get it twisted. When we talk about, maybe they might not test you on pharmacy first, we'll talk about the service. But in terms of the conditions, you have to learn those conditions. They will test you on those conditions, ladies and gents. So let's get in. So we've got common infections. There are 27. Make sure that whatever happens before the exam, you go through these 27 conditions and you know the first lines and second lines. As long as you know the first line and second lines, you're in a very good place. Then they tend to test you, if you look at the questions, on doses, monitoring, counseling. So it could be something on a counseling on an antibiotic, or it could be a question on the dose of an antibiotic, or it's to do with monitoring of an antibiotic. Then a big one, side effects. Causative organisms. In the past years, they've been asking more and more questions, at least one question on a causative organism. Jerry, man like Jerry. Jerry says, I woke up at 3 a.m. from Malaysia just to watch this. Jerry, you are a legend. Guys, what is the excuse? This man over here is up at 3 a.m. just to join the session. That is passion. That is determination. This is what's going to make you pass. This is what's going to make you pass. Well done. Proud of you, Jerry. Proud of you. And you're going to smash this exam. Yes, Omar says UTI, shingles, sinusitis, otitis media, infected bites. Now, if you look at that, you go, oh, pharmacy first. Yes, but these conditions have been tested in the GPhC exam for a very long time, and they will be tested again. So take away that hat of pharmacy first and just look at the conditions and make sure that you know them. Okay. Then we have, interactions. They tend to ask at least 1 or 2 questions on interactions. Then you have rashes, cautionary labels. Mawuli, Jerry, proper hustler mindset. That's I like that. You need to go all in, guys. If you want to pass exam, you need to go all in. That's what I'm saying to you. You need to believe in yourself. Be hard on yourself, guys. You're going for war. This is not a joke. This is not the sort of situation where you walk in there scared. This is where you put on your best confidence and you walk in there tall and make that exam fear you. Don't fear the GPhC exam. Let the exam fear you, guys. So what are the 27 common infections? Most of you have already typed them down. So let's go through. I'll give you all 27. Take a screenshot if you can. Are you guys ready? Type a yes if you are ready for the 27 common infections. Let's go. Are we ready? Are we ready? Let's go. Let's go, ladies and gents. You can do this. You will do this. Others have done it. You can do it too. Yes. So here are the 27 conditions. Take a screenshot. I know it may not look very clear. Perhaps I'll take myself out of there. Then you guys can see better. So here are your 27 conditions, guys. Mastitis, insects, cats, human bites. Dermatophyte infections, so say fungal infections, such as nails, skin infections. Chickenpox, ringworm, chlamydia, sore throat, H. pylori, cellulitis, pneumonia, CAP and HAPS, sepsis, impetigo, scabies, BV, allergic dermatitis, C. difficile, candidiasis, UTI, that's a common one. Tuberculosis, otitis, part of your pharmacy first. Scarlet fever, sinusitis, pyelonephritis, yes, sometimes. Meningitis, threadworms, conjunctivitis, and herpes. All right? These are the most common. Not all. Oh, but Marvin, you forgot one that's come up last year in the GPhC exam. These are the most common, which again, what I'm trying to tell you is make sure that whatever happens, you learn this first. And if you've learned all of this, you know the first line and the second line, then you're good. Then you are good. But please don't walk into the GPhC exam next week not knowing any of these. You need to know this because you're going to see an exam. And I want you to let me know when it comes up. I want you to send a message. I always get lots of messages from trainees as soon as they write the exam. Say, oh my God, Marvin, this came up. Okay, so next thing, all you have to do is go through these conditions and then do a table like this. All of you on my private course and stuff, you all have this done for you. And please learn the first line and learn the second line. Hannah Qureshi, what do we need to know about sepsis? You're going to see in a minute. Sepsis is important. The main thing about sepsis is just knowing the signs and symptoms, knowing the signs and symptoms in children, knowing in adults, knowing how to manage it, what to do. So if you're in a community pharmacy, and this is quite important, and they will probably even test you on sepsis, and someone came to your pharmacy, how will you identify symptoms of sepsis and how are you going to react to that? What are you going to do if someone walked into your community pharmacy and was portraying symptoms of sepsis? Okay, so that's all it needs to do. GPhC doesn't need you to go into detail about things, just need you to be able to identify things and be able to conduct that patient all the way through to safety. All right. So all you have to do is write all those conditions, write the first line and write the second line. Now, everyone for the past years, I've been giving you a website that can help you. And I really, really love this website. And the reason why I love this website is because they actually give you a condensed summary of all these conditions. They give you the doses as well. They give you the first line. They give you the second line. They give you the third line. But most of the time, your exam, you definitely want to learn at least first and second line. And so what I want you to do, I'm going to post a link on here for you. I've posted the link on there for anyone that doesn't have this. All you have to do is go onto the internet. It's sort of a nice document. Go onto the internet and you could download this condensed document of all your conditions and all the doses and the first line, second line. Print it out, highlight any of those that have a penicillin as a first line. So for example, mastitis, flucloxacillin, that is a penicillin. Highlight all of those that have a penicillin as the first line and make sure that you learn the second line of those, because the GPhC loves to test you on questions where patients are allergic to penicillins. So make sure that you download this and you also make sure that you highlight especially those that have a penicillin as first line. Are we ready, ladies and gents? 333. How many of you are loving it, getting the nuggets? Type of one. If you want me to go on, type of one. Should we focus on first and second line treatment only, or no other drugs that may be used too? So it's all about learning your first line and your second line first. You see, if I said to you, oh, listen, you need to know first line, second line, third line, fourth line for all conditions, why would a GPhC need you to know all of that for? Nobody's going to learn that stuff. I need you to know all the lines, 5 lines, every single thing in the BNF. I need you to go back and just learn everything. No, but majority of the time, and this is why I talk about predictions, they will tend to ask you more around the second line, first line, second line. In some exceptional cases, they could go up to a third line, but majority of the time, it's normally around second line. So if someone's allergic to penicillins, what do you give them? Okay, if the lady is pregnant, what else do you give them? So it's normally first and second line. So what you need to do for yourself is learn the first and the second line first. Once you've learned all of those, if you still have time, then you can start learning the third lines and the fourth lines and the fifth lines. But I'm preparing you for the exam so that if you walk into that exam, at least the bare minimum is the first and second line of these conditions. Is that clear? Type of one. Someone says nitro dosage and treatment duration. Absolutely important. Very important. Okay, so next slide. Side effects. You need to know your side effects. Guys, let's answer these questions. They'll ask you different side effects. For antibiotics, it could be those that cause blood disorders. Which antibiotics cause blood disorders? Type in the chat. Any antibiotic that comes to your mind that causes blood disorders, type in the chat. Yes, Ome, you're totally right. Trimethoprim is like one of the first ones that come to our minds. And it's so important you know this because trimethoprim is a common antibiotic and common drugs are common in your exam. I cannot stress this, ladies and gents. I cannot stress. Common drugs are common in your exam. Those antibiotics that you're dispensing every day. That's why it's important. This exam is not only testing your knowledge of the BNF, it is also testing your work in the pharmacy every single day. It's testing the practical side of things. So those antibiotics, your erythromycins, your amoxicillins, your flucloxacillin, those fast movers in your pharmacy, your fast lines, your metformins, your amlodipines, these are the drugs that tend to test you on. Okay, common drugs are common. Right, so what about red man syndrome? What causes red man syndrome? What causes red man syndrome? Let me know. Yes, vancomycin, very good. Learn that, it's quite unique, so please learn this. What about urine change? Which antibiotics cause urine change or change of your bodily fluids? Which ones come to mind? Let's go. Let's type quick. Remember, the exam is not only about a test of knowledge, it's a test of speed. And guys, by the way, did you know that even though I say more than 70% of trainees pass the exam, even those that fail the exam, majority of the time only fail by a few marks, 1 or 2 or 3 marks or 4 marks. And they're normally due to very little errors that they made, a decimal place, did not read the question properly. I missed the keyword in the question. So even those that fail the exam, they don't fail the exam because the exam was so difficult or they ran out of time. Majority of the time, they fail just because of little errors. Yes, so nitro, good stuff, good example. Common one, it is a common drug, so you might see that in your exam. Rifampicin, another one that comes up with current urine change. What about peripheral neuropathy? What comes to your mind? Peripheral neuropathy. There you go. Just to confirm what I'm saying, Junk Known, I don't think that's your name, but Junk Known says that I got 80 out of 20, failed by 2 marks. And I can bet you guys, if you Junk Known, I can tell you 100%, I know this. if somebody gave you that paper again straight after the exam, if you finish the exam and someone said, "Hey, John, no, you've got about 10 minutes to just go through this paper again," I bet you 100% you would have picked up 2 errors that you've made. 100% or even more. If you had the time to go over that paper again, you would have noticed that the things that you got wrong are not things that you did not know. The most likely things that you knew, but you either didn't write them, you missed them, maybe ran out of time, I don't know. But majority of the time, it's not really due to impossible questions. You do get questions wrong that you actually know the answers. Man like Jesse, I failed by 6 marks for clinical. Last November, it wasn't my lack of knowledge, it's just my confidence had a bad sit. There we go. There we go. And that's why people tell me the way I help many trainees pass is because when you come close to the exam, many people are still trying to do loads of questions, or they're trying to read, they're trying to go through all of this stuff. That's not what you should be doing the last week of the exam. The only thing that's going to stop you is not that knowledge at this stage. It's going to be your confidence. It's going to be self-doubt. It's going to be anxiety. That's why we really need that confidence, because it doesn't matter if you've read as much as you want. If you walk into that exam and you're nervous and you're doubting yourself, you're going to forget. You're going to forget, you're going to be slow, and you're going to miss all those important things that you know. How many times do you know, guys, when you've gone into an exam at university where you actually knew something, but during the exam, you're so nervous and you totally forgot it? And it's only when you came out of the exam, when you're a bit calm, you go, "Oh my gosh, I just remember the right answer now. I don't even know what went on in there. I was just so nervous." So please make sure the most important thing in the last week of your exam is your mental state. It's not learning more clinical stuff. It's not doing more and more calculation questions. It's not practicing more and more mocks. It's all about learning to believe in yourself and believing everything will be all right. Breathing, walk into exam and do well. What was Lisa saying? Lisa is saying, "I failed only by a few marks on clinical in my second attempt. I literally gave up in everything, but Marvin pushed me and I passed with 96 out of 120 and 32 out of 40. So you can do it. This is powerful. Well done, Lisa." Lisa was amazing. I had Lisa had failed the exam twice, right? Yes. Lisa was going to give up, but guess what? She passed. And she's here telling you, listen, if she can do it, you can do it too. There is no reason why you should fail this exam. There is no reason why you should fail. You have everything you need to succeed. If you don't believe that, then you're sabotaging your own success. Again, I said to you guys, you don't need to know everything to pass. You don't need to be so good in clinical. You don't need to be a calculations expert. I was awful in calculations. I'm very sure 100% I must have got about 10 calculation questions wrong in my exam. But guess what? I still passed. All right. So you don't need to be perfect. You don't need to be the best. You just need to know enough to pass. And that's what I'm giving you today. Okay. So next one. Are we ready? Type of 2. If you're ready for the next slide. If you're ready for the next slide, type of 2, type of 2, type of 2. Big up, Lisa. Congratulations. And Lisa, not only has she done well, but the best thing about Lisa is she literally has spent the last years of her life helping other trainees like yourself succeed. And that's one of the best things. When you see someone pass and comes back to help others, that's what makes them a unique human being. And that's what Lisa's been doing. She's helping so many trainees pass, so many trainees. Great. So here's what I have. Examples. This list is not exhaustive. Oh, Marvin, these are the only drugs that cause blood disorders. No, these are the most common ones. All right. So the most common ones. So we've got trimethoprim, linezolid, gentamicin, vancomycin, Renman syndrome, vancomycin, nitrofurantoin. So take a screenshot, because again, this is not going to go on after this. Okay. Is there going to be another exam prediction video after the June exam for November? Yes, most likely. I normally try to do this before the exam. So yes, I will do that for the November students as well. Okay. So next one, they tend to ask about causative organisms. Does anyone know? Food poisoning is common. So do you guys know what causative organisms cause food poisoning? There's a few of them. Type down in the chat anyone that you know. Suki says, Lisa support is amazing as a period shortcuts training member. Yeah, it is amazing. Lisa, I work with Lisa every day, and I cannot, guys, honestly, I've never met anyone that's as dedicated. Lisa goes all in to help. Honest, I've never met anyone like her. We've got, yes, Salmonella, Shigella, Salmonella. E. coli. So I think E. coli and salmonella are the most common ones, 100%. So salmonella, E. coli, norovirus, Campylobacter examples. UTI, you have E. coli, Candida, whooping cough, Bordetella pertussis. This is very important. Now, almost every single exam, I don't know if they're going to do it this year, but in the past years, they've been asking at least one causative organism. Another thing I need to tell you, if you don't know this yet, guys, the GPhC repeats questions. All right. The GPhC repeats questions. There are many exams where they've asked questions that they've asked in previous exams, even if it's not word for word, but they have still asked the same question around the same theme. So it's very important that when you see these things that have come up in the past, you may be seeing them again. Lisa pushed me to do at least 25 to 30 mock papers. I was about to cry, but she pushed me not to give up. Wow, that is so good. That is so good. That's the secret to pass. More questions. Okay, antibiotics, pregnancy. Every single exam, pregnancy is important. They will ask you questions on pregnant women. They will ask you questions on breastfeeding. They will ask you questions on children. So, which antibiotics are safest in pregnancy? And there's a reason why we've underlined safe first. It doesn't mean that there are no other ones that you can use, but these are the safest ones that you go for as first line. Great. What we got, I can tell those of you that have been on my course, you're writing GPhC. That's my mnemonic right there. Good mnemonic to help you. So when it comes to pregnancy, you could get, there are different antibiotics that you can give, but the safest ones are these ones. Okay, GPhC, PEX for your chest. So breastfeeding, pregnancy, P for penicillins. Penicillins are safe in pregnancy. You don't have to worry about a pregnant woman on amoxicillin. You don't need to give her any extra counseling. Erythromycin is safe. It tends to be the alternative that you give normally, erythromycin, for example, if a pregnant lady is allergic to penicillins. And that is a common question. You may get that question in the exam, right? It may be a question on a pregnant lady that is allergic to penicillins. And the option will be erythromycin. Then you have clindamycin and then cephalosporin, PECC. These are the safest. Now, this doesn't mean, oh, Marvin, oh my gosh, oh no, my doctors gave someone on Dancetrone once or something else like that. These are the safest. You can give other antibiotics, but these ones tend to have the safest profile. Okay. Marvin, can I get a six-pack like you? Of course. Join my personal training sessions. I'm doing training for pharmacists that want to be fit, that want to train. I'm actually helping pharmacists now, just pharmacists and training pharmacists become fit and healthy. Okay, another area is your red flags. And they love to ask you questions on red flags, on rashes, especially with children. So this is like a cross between your clinical and also OTC. So you need to have good clinical knowledge, but you also need to have good OTC knowledge. And that's where your red flags come in. Now, the reason why red flags is so important is that every single GPhC exam, they tend to write down the feedback about how patients, how trainees performed. And then they're going to write down the questions that trainees struggled with the most. All right. And in almost every exam, this tends to come up being an area where trainees struggle, knowing when to refer and when to treat patients in the pharmacy. So when can a pharmacy treat a patient and when should they refer this patient to the GP or to hospital 999, etc. Okay, so what are your red flags for your rashes, guys? We've got Mawuli has written non-blanching rash, for example, meningitis. So yes, you need to know every single rash. And these are common questions because they know that these are things that you will potentially face in the pharmacy, even on your first day at work. So Amara Angel is missing me. Marvin, where did you go? I'm back. I didn't realize I'd not put myself back in, but I'm back in. So this red flags, the reason why it's so important because the GPhC knows, and they're going to test you that from day one, you could be working as a responsible pharmacist and someone walks into your pharmacy with a rash, or you have a phone call from NHS, something, and you have to identify that that rash is not a red flag, right? Or that condition is not a red flag. So anytime you get a rash, always look out for these, okay? If you have a rash, you're looking out for stiff neck, you're looking out for photosensitivity, confusion, high temperature with the rash, breathing changes, non-blanching, change of color. These tend to be red flags. You refer them, you don't treat them. So please learn your red flags. Very, very important. Next one, what rashes? So there are 14 common rashes that get tested in the exam. You wouldn't get all 14 in one exam, but as long as you learn these 14 conditions, just like the other conditions, the antibiotic conditions, as long as you learn these rashes first, then you can learn other things. But make sure you at least know these 14 rashes and how to manage them. Jerry says, Marvin, go back. I haven't screenshot this. Okay. All right. Take a screenshot and we can move on. The bottom line was covered by the banner, was it? Okay, let's see if I can take that off. So it's blue, gray, or blotchy skin or tongue. Take a screenshot and we can move on. Okay. So next one. Okay, so let's look at, can you guys type in what these rashes are? So you guys know how important rashes are and you're learning this stuff. So tell me, what are the rashes that you think tend to come up a lot in the GPhC exam that you absolutely need to learn? If you're to give your friends advice, you're going to give your colleagues advice right now, you're going to give your GPhC exam predictions. What rashes are you going to say? Marvin, I think this is one that I've heard or most likely going to come up in the exam because it's come up before in the past and students have told me and people, maybe other pharmacists have told me that this came up in their exam, so I need to revise for this. Very good, very good. Molluscum is one that comes up a lot as well. So here's what I'm going to do. I'm going to give you guys 14. Again, this list is not exhaustive. I'm not saying there's nothing else. There's no other rashes. Please don't misinterpret what my predictions mean. My predictions mean that you need to learn this stuff. My predictions mean that you definitely need to learn this stuff. And then you can add other things. But make sure you don't go into exam without knowing these predictions. So here are them. I've got slap cheek, hand, foot, and mouth, scarlet fever, measles, heat rash, atopic eczema, allergic dermatitis. Again, this is a cross between therapeutics and OTC. Ringworm, chickenpox, impetigo, scabies, molluscum has come up a few times, nappy rash, cradle cap. Okay, these are the 14 that you definitely want to learn. And so the way you learn this is you need to know how they look. So in the exam, they'll tend to give you a picture. You need to be able to recognize the rash just from a photo, or you need to recognize the rash from the symptoms that are described to you. Then the second thing you need to know is how to treat them. So how do you treat them in the pharmacy? Which ones will need antibiotics? Which ones have ailments in the pharmacy that are used to treat them? Very, very important. Aisha says NHS is good for pictures. Yes, NHS Choices is the best website for these rashes, for the pictures. And the GPs tends to use those pictures as well in the exam. So go to the NHS website, NHS Choices, and learn these conditions using those pictures there. Also, it's so important that you learn how this rash presents on dark skin, because previously all the questions were on Caucasian skin, but with the diversity and all the changes, now we know that it's important that in education, we represent everyone. And in your GPhC exam, they're tending to ask you as well these conditions on dark skin. So anytime, if you look at chickenpox on a Caucasian skin, make sure you also look at what chickenpox looks like on a dark skin. Okay, so drug interactions, another big one. Every exam without fail, there's going to be 1, 2, or 3 questions on antibiotic interactions. Every exam, there's definitely going to be questions on interactions. So, but what sort of questions are we expecting? Which ones come up most of the time? Number 1, antibiotics and contraceptives. General rule of thumb, and I've taught you guys this in the course, for contraceptives, you don't really worry too much about inhibitors. It's normally your inducer antibiotics that tend to interact with contraceptives. Okay, so tend to be your inducers. So things like rifampicin, these are the drugs that interact with contraceptives. But for inhibitors, things like erythromycin, you don't really bother. Most patients are fine taking inhibitors and still taking the contraceptive pills, for example. Antibiotics and statins, another common one that comes up, which most of you know because we learned this since university. Probably one of the first interactions we learned was your antibiotics and your statins and withholding the statins while you're taking the antibiotics. Clarithromycin, amoxicillin, common type of example. Next one is trimethoprim and methotrexate. Trimethoprim and methotrexate, very important. Very, very important. It's come up a few times. So these interactions, what's the interaction, by the way, between trimethoprim and methotrexate? Yes, rifampicin affects oral contraceptives. Yes, because it's an inducer. So someone says antifolate. Yes. Antifolate. Yes. Antifolate. Yes. Myelosuppression. Yes. Good. Good antifolate, all antis, yes. So you tend to, there's quite a few, and they could give you questions in the exam asking for a different interaction for this too. So it could either be an antifolate interaction to both antifolates, or it could be to deal with myelosuppression, or both cause blood disorders, or they also cause nephrotoxicity. So it could be something to do with the kidneys. So that's a common sort of interaction they love to test you on. Quinolones and NSAIDs, the GPhC loves to test you on questions where you have a PMED or an OTC med interacting with a POM. Okay, they love to ask those questions. They always tend to have like one question interaction, for example, warfarin and Dactarin oral gel, for example. So they tend to ask you those questions where something is a POM and it interacts with a P, because I want to make sure that you don't sell this to someone. So typical situation is a patient comes to your pharmacy that is on ciprofloxacin and has come and is having some muscular pain and wants to buy some ibuprofen. And you need to decide where to sell it to them, blah, blah, blah. So in this case, you wouldn't, because it could increase the chances of them getting a seizure, even if they don't have a history of epilepsy. Okay? Even if they don't have a history of epilepsy, they can still get a seizure with quinolones and NSAIDs. And that's the scary part. Okay. Nadia was saying, Marvin, if there's an option that says stop statin or change to a different antibiotic, which option do we choose for statins and clarithromycin? I don't understand that question. If there's an option that says stop a statin or change to a different antibiotic, which option do we choose for statins? And I'll have to say the question because it's not too clear. If a question says stop a statin, then based on that question, if the patient, I don't know, if the patient was on simvastatin and has been prescribed clarithromycin, then yes, you will stop the statins until they finish the course of the antibiotic. You'll only be changing to a different antibiotic if there is no interaction. Majority of the time, based on that specific question in the exam, a question with a statin, generally you will stop the statin with an antibiotic. Generally. And again, depends on the type of antibiotic. And then what's that? Which option do we choose for statins and clarithromycin? Tends to be clarithromycin and erythromycin, your macrolides and statins. That's the interaction. Macrolides and statins. Okay, yeah. So generally, it all depends on, in the exam, it will depend on that question. So again, as I said, generally with the statins, we will stop. You may have some questions where you have to change an antibiotic, right? But that'll be due to if there's a reaction from a specific antibiotic. For example, a patient is allergic to penicillin, then we're going to change amoxicillin and give them something else. But this specific interaction between the statin and erythromycin, we know fully well that if they hold the statin, that's not going to change much. It's not going to, for a few days, for 7 days, it's not going to ruin their lives. They're not going to die. They're not going to have a seizure or anything like that. Okay, so next one is your quinolones, right? So quinolones, I have a feeling they will definitely ask you questions on quinolones because quinolones have had a few MHRA updates recently, and they've just been going down the pecking order. So right now, quinolones are like your last option of your antibiotics. So quinolones and antipsychotics or macrolides, what's the interaction? What about if the patient has familial hyperlipidemia? Can they still go without antibiotics for a week? Yes. Not without antibiotics. You're talking about going without the statins for a week. Not without the antibiotics, without the statins for a week, yes. QT interval prolongation, yes, QT interval, that's it. So QT interval prolongation is when they may come up, arrhythmias, all the signs of arrhythmias, okay? You can get that if you give a patient an antipsychotic and a quinolone. And then antibiotics and milk, these are normally your label questions. You need to know which ones you can take with milk and which ones you need to avoid milk, okay? And then, I'm just aware of your time, okay? So we still have about 9 minutes. Right, someone's asking about sepsis. Sepsis is a big one, is a very important one, and the GPhC really needs you to know the signs of sepsis. You need to know the signs, and both in adults and children, especially children. And you know in your exam, 20% of questions will be from children. That's how important it is. Again, someone asked about predictions. These are predictions. The GPhC actually says 20% of questions will be from pediatrics. So there'll be questions related to children. So either be some of these rashes that we've gone through. It could be things like ibuprofen, Nurofen doses. It could be this sepsis, identifying the signs of sepsis in children. So what do we have in children? We have reduced urine output. Yes. We have high temperature. Yes. Increased breathing rate, increased heart rate. Dry nappy is one that is an important one. Dry nappies for kids. Great. Okay, so signs of sepsis in children: very high or low temperature, no urine all day. So that's why you guys mentioned dry nappies. That's a good sign. Vomiting, breathing very fast, non-blanching rash. Just like we'll talk about meningitis, blue pale lips, and the baby has this high-pitched cry. Okay, so please learn your signs of sepsis, both in adults and in children. 313 of us. Wow, this is great. Wow, it's a lot of us on here. 313. That's crazy. Okay, your doses. Let's look at your doses. Now, if someone was tell you, oh, you learn all the doses in the BNF, they're doing a very huge disservice. They're making your life difficult. You don't need to learn every single dose in the BNF. Not only is it impossible, but it is very stupid. It's very stupid to try to learn every single dose in the BNF. But what you need to do is at least learn the most common drugs. And what I say is those ones that you dispense every single day. Right? Your amoxicillins, your Fluclox, your metformins, your amlodipines, your fast lines. Try to learn the doses. So nitro is a very important one. It's come up a few times in your exam. And UTI, they love to ask you questions on UTI. So I've got a table here for you. And please learn this table. It tends to come up in your exam. I remember a few, I think it was last year or 2 years, I was going through this with the trainees. They walked in the exam the next day, and that's exactly the question they saw. So you need to know nitrofurantoin, know the dose, know the duration. Trimethoprim, nitrofurantoin tends to be 3 days, 3 days. But for men, 7 days. For pregnant women, 7 days. We know we don't give nitrofuran to pregnant women at term, so that's the end of the pregnancy. But we can give nitrofuran throughout the pregnancy at the beginning. We avoid trimethoprim totally, which is an antifolate. We don't want to give trimethoprim. Lisa says, yes. Lisa says, this came up in my exam. You guys will see these questions and you'll remember me. You can go, oh yeah, Marvin mentioned this. What do we give? A pregnant lady has this, less than this. Do we give cephalexin? Most likely AXA. That's a good question because we're not going to give nitrofurantoin if the CL is that low. Less than 30 mils is contraindicated, then so it's most likely going to be something like a cephalexin. And if you want to make my life even harder, you go like, oh, Marvin, what if the lady was allergic to penicillins? That don't GPs are not going to make your life that hard. But yes, Yes, absolutely. It'll probably end up being something like cephalexin. Um, so learn those. Know your side effects. Now, are you going to learn all the side effects? The BNF? No, but there are some antibiotics that different GPhC exams tend to test them. Okay, and you're looking at things like macrolides. You need to know your side effects with your macrolides, your clarithromycins, your erythromycins, azithromycins. You need to know your side effects of quinolones. Quinolones is quite popular. It's a quite popular one with quinolones. So you need to know your side effects of quinolones, for examples like aminoglycosides, and in general, all your antibiotics, right? Your penicillins, macrolides, quinolones, to me are probably the most common ones you get tested on. Penicillins, macrolides especially. Okay, let's look at this childhood rashes. What rash is this? Because you're going to get pictures in your exam. You're going to get pictures and you have to identify rashes. This is where you have to go onto the NHS Choices website and look at the pictures on there. You tend to see an exam. So it's a bit harder now because I'm just giving you pictures, but in the actual exam, you're going to have more information because sometimes you just can't tell a rash just by looking at the picture. You need more because some rashes are quite similar the way they look. So although I'm showing you pictures, there may be some in the exam you're going to have more information to guide you in terms of the description. So some of you have gone for measles, some of you have gone for scarlet fever. Okay, let me make that bigger. So this looks more like scarlet fever. Again, as I said, they're going to have to give you more information in the exam. I'm just giving you this just to see where you guys can pick it up quickly. But this is more scarlet fever. What about this one? What is this? Shingles. Yeah, I think most of you know that. It's on one side, on torso. Yes. What about this one? This has come up in the exam as well before, maybe once or twice. And again, I tell you guys, GPhC repeats questions. So if there's something that's come up in the past, it could come up again. Molluscum, correct. Correct. Neen, correct. Molluscum. So another thing you need to learn then are your cautionary labels and food interactions. So you have drug-to-drug interactions, but in this chapter, you also have food interactions you need to know. So cautionary labels, you need to know which antibiotics need to be taken before food or on an empty stomach. Give me examples. Which antibiotics need to be taken before food? So these are things that need you to learn. Guys, they're not difficult, but it's because they're very common in your pharmacy. Things that you could see from day one in your pharmacy. All right, so Fluclox, drop parts. Thank you, Evelyn. That's my mnemonic right there. I love mnemonics. It just puts everything in one place rather than typing a lot. Makes your life easy. So we have which antibiotics need to be taken before food on an empty stomach, and then which antibiotics need to be taken with or after food. No, they wouldn't have any replays because I need everyone to come on here. Right? If you're serious, you're going to turn up. And if you're not serious, you're not going to turn up. So I only do the sessions for trainees that are ready to dedicate the time and be on here. I don't want to do sessions and I'll take my time and do a session and people be like, I'm not going to turn up. I'm just going to watch it in like 2 days, 3 weeks. No, if you're really serious, you're going to be on here. So everyone that's on here, I appreciate all of you. And that's the reason why I don't put up a replay. I want you to be on here. I want us to interact. This is so important for you. Okay, which antibiotics need to be taken before or with food? You need to know these. Very important. Been tested on this in the past. You get tested again. Marvin's Nice Pizzas. Most of you have seen, what is all this Marvin's Nice Pizzas? These are all guys on the combo course, putting the mnemonics, some of you on the private course as well. So yes, very good, very good. But those of you are not on the course and you're asking, what do I need to learn? Please learn these ones. These are before food, after food, or with food. Okay, what about those that can be taken with milk and those that have to be avoided with milk? Which antibiotics can we give with milk? Great, more mnemonics, more mnemonics. These are just about mnemonics, guys. Don't even waste your time trying to understand. Just learn your mnemonics and you're fine, right? Dogs like milk. Learn your mnemonics and you're fine, guys. It's all about mnemonics. C dot. Marvin has the best acronyms. There you go. Banana Clips has said it. Yeah, you need acronyms to pass this exam, guys. You can't learn everything. You just need lots of acronyms to make your life easy. So these are all acronyms. Okay, so what antibiotics require protection against sunlight? So photosensitivity. Which antibiotics you need to shield yourself from sunlight? The nice cheese pizza acronym stuck in my head, and it will come in the exam and you will smash it. Yeah, so it's most like your tetracycline. So decycline is probably the most sensitive of all of them. So doxycycline, demoxycycline, most common than with tetracyclines. So, ladies and gents, I think we're going to stop there. That is step 5. That's the end, actually. That's the end. That's the end. Exactly 1 hour, which is what we promised. We don't want to take too much of your time because, exam is getting close. You guys need to dash off. So, guys, 35 slides we've gone through. Make sure these are GPhC exam predictions, okay? Please make sure whatever happens, you know this stuff. I hope you guys took screenshots. Please, please, please. I don't want any of you to fail. I don't want any of you to regret this. I want all of you to pass, and that's why I'm taking my time to do this, okay? But please make sure you put the work in. If you want to see the results, you have to put the work in. And so please go back and make sure that you learn all this stuff. I'm just going to go through for anyone that joined late and that did not get screenshots of the slides. I'm just going to go through and you can take the screenshots now. Okay, so this is the first slide. This was the agenda for today. Slide 2, most common assessment areas. There were 7 common assessment topics in the infections chapter. These are the 7. Okay, these were the 7 common tested topics. And as long as you learn this, you will answer quite a lot of those questions in infections. So I spoke about the 7 common infection areas to learn, and these were them. This is 20, and I've got 7 more. So this is a list of all those important ones to learn. That whatever happens, make sure you know this by next week, and these ones. So what do you need to learn about these conditions? Learn the first line and the second line. All right, learn the first line and second line, do a table like this. First line treatment, second line treatment, and take particular notes, especially for the conditions that have a penicillin as the first line. For example, mastitis, fluclox is a penicillin as the first line. Take specific notes of those ones because they tend to ask you things on allergies. And then we have the side effects. They tend to ask you questions on side effects. And we had some of the common ones: blood disorders, Redman syndrome, urine change, peripheral neuropathy. And I gave you some examples. It's not exhaustive. Nothing here is exhaustive, but these are like the common ones that tend to come up. Then we had causative organisms. They tend to ask at least 1 question now in the exam on a causative organism. So food poisoning, UTI especially common. Then we've got whooping cough. And these are more examples. Then I went to pregnancy. We said, what are the drugs that are safest, the antibiotics that are safest in pregnancy? And we said it's PEC-C. This means these ones tend to be fine with pregnant women. We went to rashes. We said you need to know your red flags when it comes to rashes because this gets tested again in every exam. And we went through the red flags that you need to watch out for in your exam. Then we said there were 14 common rashes that come up in your exam, common rashes, and we said these ones. And what you need to know with these, we said you need to go onto the NHS website, NHS Choices, and make sure you learn the pictures of what these rashes look like, and also learn the symptoms. So this is a cross between therapeutics and OTC. Then we said interactions. You always have 1 or 2 questions on antibiotic interactions. And then we had a table of the common interactions that you have to know. Then we spoke about sepsis. Very important to know about sepsis, know about the signs and symptoms, know about the treatment, especially in children. So we went through the signs of sepsis. We spoke about doses, learning your doses, especially UTI doses, right there. And then we said know the side effects of your antibiotics, groups that are common in your exam, macrolides, quinolones, aminoglycosides, but macrolides, quinolones especially. Then we said you need to learn those childhood rashes, and you can learn this in NHS choices. Look at the picture and be able to identify the rash, because in every exam, there's going to be at least one picture of a rash. Then learn your cautionary labels, but the best way to learn them is with mnemonics. That's why we have all these mnemonics. Okay. Your labels with milk, without milk. This is just about mnemonics. And that is it, guys. If you learn all of this stuff, I can promise you right now, you're going to be in a very, very good place when it comes to the exam. Okay. So thank you all, mates. Well done, Jerry, for making 4 a.m. We're going to let you go to bed now. Thank you all so much. So I'm going to do more sessions again. The next one I think I'm going to do with pre-read shortcuts. All of you on the pre-read shortcuts, you know Lisa's put on a very good plan for you guys. So every evening we'll have revision sessions, and Lisa gave you guys the plan. Today I decided to do this live just to mix it up a little bit. So I don't know what topic you guys have tomorrow. I think tomorrow might be CNS, if I'm not mistaken. I think tomorrow might be CNS predictions and CNS revision. So guys have CNS tomorrow, and then I will still do another live for some of these to help you. Okay, great, guys. I will let you guys. Someone's asking, how do you make your predictions? I've been doing this for 10 years. Allah Hussein. I've been doing this for 10 years. And when you've done something for 10 years, you go through 10 years with trainees, and every year there are 2 exams. So these are like experience of 20 GPhC exams. You will talk to students, you will know, they will tell you what questions come up. You're going to like look at the GPhC website, you see what GPhC is saying. Just by interacting with students, you're going to know generally what kind of things come up. You're going to do loads of mock papers. You're going to go against that GPhC website. You're going to see the feedback of areas that students struggle the most in exams. So all of these will help you to have an idea. You go to the GPhC framework, you see what they say about the areas that get tested the most, high rating, medium rating, low rating, how many questions come from pediatrics. You're going to see about the high risk drugs. You see all these things, and then after 10 years, you know patterns, and that is how I do it. So a lot of work has gone into me trying to predict, and I don't expect you to know, but I've been doing this for a long time. Okay, so I might put another video up on YouTube on predictions. So take care, guys. I know you guys have a good evening, and I hope you have a great time, and I look forward to seeing you all soon. Good luck. See you all soon. Bye.